Let's turn to Illinois, a state that's reported more than 6,700 new cases in the last 24 hours. In Chicago, there's a rush to get tested for the virus ahead of the holiday. One doctor telling us it's a good thing. Listen in.
People are taking this seriously, so we're glad that they are testing.
NBC News correspondent Shaquille Brewster is at a testing site in Chicago. Shaq, welcome in. Thanks for being with us. I know it's really chilly there. You're trying to stay warm. The big question here, why are so many people getting tested in Chicago right now? Is this all because of the weekend and the holiday coming up? What are you hearing?
It is, yeah. It has a lot to do with this holiday coming up, the weekend holiday, and then going into the holidays next week. People are traveling. People are going to be having those gatherings despite the advice of medical professionals. You know, this is a part of a pattern that we've now seen. We saw it before the Thanksgiving holiday, where you saw a surge in testing the week before Thanksgiving Day and into that weekend, and we're now seeing it again ahead of Christmas holiday. We're at a drive-up testing facility, so people come up, medical professionals go and give them their tests. Many of the people here are opting to do rapid testing because they are planning to either travel out to go meet with family, or they're planning to have those holiday gatherings. Although many of them do also say that they're going to that they're offering some concessions to this virus in a certain way. They're saying that, you know, their Christmas gatherings won't be as large as they normally are. There'll be a smaller amount. They won't travel as far as they normally do, but they still want to come and get tested to take that initial precaution. Listen to a little bit of some of my conversations from earlier today. So you're traveling to New York. This is essentially a precaution for you.
Correct. Well, it's also the regulations that say we need to get tested before, unless we want to do a 14-day quarantine. But yeah, it's challenging. Luckily, I mean, her family's in good health, so it's a calculated risk. But I guess everyone needs to make their own decisions. We haven't seen her family. We've barely seen her family at all during the pandemic. So for us, it was worth it to go to New York.
Yeah, you know, I actually took a mail-in test a while ago and just heard that FedEx lost it. So in order to go home and be with my mom, you know, I got to be safe, make sure that it's negative. So
that common theme is a word that you heard in one of those answers, that it's a calculated risk. That's what people are suggesting, that they're willing to go and meet with their family and get that experience as long as they have the negative test. And then many of them say once they get there, if they travel, they plan to be safe. They plan to wear a mask, social distance as much as possible. But there's that priority because it is the holiday. Corey?
Yeah, and Shaq, my first thought of all of this is, of course, timing. It is Christmas Eve. You mentioned the rapid testing. So how long does it take to get some results back? And then a follow-up here is that, you know, some doctors say that even a negative test isn't quite a green light to go to some of these gatherings. Explain.
That's exactly right. I'll tell you, the people who drive up here to get that rapid test, they are told that if they don't get a call within about 2 hours, then that means that was a negative test, and then they're later emailed the results formally. But if they do test positive, then they get a call telling them that they're positive and giving them guidelines on how to quarantine. But the point you made there was so critically important, and it was the same point that I heard from the medical director here at Clear Wellness, who's operating this facility and 2 other facilities across the state of Illinois, and actually in the Chicago area. They're making the point that just because you have that negative test, don't drop your guard at that point. Just because you test negative, say, this morning, you can still be contagious later this afternoon. It doesn't, tests pretty much just measure where you are at that given moment. And especially with the rapid test, where we know that there's a level of, it's not as pure as the PCR test. It's not as good. There's some room for error with the rapid test. That's why they're really suggesting that you shouldn't take a negative test as meaning too much. Of course, if it says you're positive, you should definitely quarantine and not engage in any of the travel that you were planning on doing. But if you tested negative on a test, that's not a free pass to just continue on as you normally would if we weren't outside of this pandemic.
And not only do you not know if you will test positive, you know, later on down the road, but you also don't know if you're picking something up as you're traveling through those airports and whatnot. I want to talk a little bit about where you're at specifically, Shaq. They're in Chicago. How are they keeping up with this increased demand in testing now?
Yeah, you know, one other thing that the doctor warned of is that there's going to be fluctuations in numbers that we talk about. So it's going to be hard in the next couple of days to gauge exactly how Chicago is doing in terms of handling this coronavirus and how Illinois and how other states are dealing with this. But, you know, the big thing with Chicago is that right now, if you look at, this is a private testing facility, most of the city-run testing facilities are closed because of the holiday. So it's not a matter of keeping up with the testing. They have the capability, they have the infrastructure there, but it's a matter of it being a holiday. Many of the current testing sites are closed, so people have to resort to using private sites where here you have to pay out of pocket, for example, especially when it comes to that rapid test. So it really is going to be a guessing game over the next week. We're going to see numbers go up. Something we saw during the Thanksgiving holiday, for example, is during that week, you saw the positivity rate increase, and that was because mostly the idea is if you're going to get a test during the holiday, that means you are more likely to be symptomatic than just going as a precaution. So those numbers will fluctuate a little bit. That's why you hear from medical professionals and from officials, you should just follow those common things that we've been talking about. Washing your hands, socially distance, wearing that mask. If you stay true to that, the testing numbers and the tests that you may get or any potential of a false positive, those don't become a factor in keeping you and the people around you safe.
And Shaquille, is there any word yet from leadership in Illinois if there's a plan for this next surge after the coming holidays a week or two from now?
You know, it's hard because what you saw the past couple of weeks is that Illinois was starting to turn the corner. At least it reached its peak. It wasn't hitting records every single day. The problem with that is, as you mentioned in the introduction to me yesterday, it was about 6,700 new confirmed cases. There were several more hundred people in the hospital. So there was a feeling that they were moving in the right direction, and that there's now concern that the Christmas holiday and the family gatherings that could potentially reverse the trend. That's really what we're seeing right now. I'll tell you, in terms of what officials are doing and what they're planning, it started to become to a point where the question started to be asked whether or not indoor dining in the city of Chicago should be allowed again. And the governor said, I don't want to go back and forth from closing restaurants to reopening them. Let's just make sure that we're in a good place. So officials here know that you have to continue to monitor these numbers as they come in. They'll wait to see what kind of wave or what kind of surge there was after the Christmas holiday, and then that will determine what steps are taken, whether or not they move to phase 1 or phase 2 or phase 3 based on the numbers and the positivity rate that are there. But again, that's where the concern comes in that these numbers for the next few days at least, and potentially weeks, will fluctuate as it's just an infrequent amount of testing, and it's not an even baseline that you have to measure against as you would normally when you don't have people traveling, you don't have people going out as much as they are going to be doing in the next couple of days.
Yeah, as you say, the goalposts keep getting moved, and I hate to say it, but I think a lot of health officials are just praying for the holidays to be over so that they can kind of start to get a handle on that surge. Shaq, thanks so much for your reporting from Chicago. Try to get some warmth now.
Well, thank you.
The U.S. reaching another grim milestone. Almost 120,000 Americans were in the hospital Wednesday because of the coronavirus. That's a new record high. And the CDC says up to 23,000 more Americans could be hospitalized by mid-January. This as calls to increase to test for that mutant strain of coronavirus found in the U.K. NBC News correspondent Aaron McLaughlin has the details from Los Angeles.
The number of hospitalizations across the United States have more than doubled since November. States are seeing an exponential rise in cases. Here in California, the first state to surpass 2 million total cases. And as people are moving for the holidays, there's a real concern that this situation is only going to get worse. The day before Christmas, healthcare workers fear this may be the eve of yet another dire surge.
The trend lines just continue to go up. There's no sign of a plateau.
With cases spiking across California, ICUs at nearly 99% capacity. Patients spending Christmas Eve in hallways, conference rooms, even parking lots.
Everyone's like a different shape, size, age, background. We can't predict who's going to come in next.
The holiday threatens to push the system even further over the edge.
This is one Christmas where that large gathering should not happen. If it does happen, people that you love may not be there for the next gathering.
Across the country, 11 states have seen an over 60% rise in deaths. As New York's Governor Cuomo says, hospitals should start testing for the new, possibly more contagious strain already detected in the UK.
If it is here, I want to know exactly where it is and then isolate it immediately.
You're doing really good, okay?
In Tennessee, nurses say they're seeing patients die on every shift. And in Utah, they're watching each other fight for survival.
I actually had the wonderful privilege of taking care of her and being her nurse for quite a few nights. And it was hard.
After caring for COVID patients for months, Nurse Jill Holker is now on life support, battling the virus herself while waiting for a double lung transplant.
She's fighting for her life, and we can't really do much about it. We just have to hope and pray and just think the best every day.
Amidst the uncertainty and despair, compassion. At a hospital in Los Angeles, Santa Claus brings Christmas cheer.
Oh my goodness!
Passing out gifts in the neonatal ICU, including tiny clay molds of the baby's feet. A powerful gesture of hope and care.
My one wish for this season, we're only going to get through this okay if we abandon selfishness.
The CDC announced that it has vaccinated 1 million people receiving those critical first doses so far, but that's far short of their earlier projections of 20 million doses. 9 million doses shipped. Authorities say they plan to pick up pace in the coming weeks and months.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.